After insisting for several weeks that the numbers would be better if fewer people were tested, the Trump administration has now directed hospitals to hand over their coronavirus data to the Health and Human Services Department and to remove the Centers for Disease Control and Prevention from the process. There has even been a suggestion that the National Guard could help collect the data. Is the CDC not trustworthy with this information, or is this an attempt to help guide the numbers so that they don't appear as bad as they are? Health and Human Services Secretary Alex Azar and the response coordinator of the White House Coronavirus Task Force, Deborah Birx, sent a letter to the United States governors, noting that the National Guard could help with data collection from hospitals. They ordered the changes to not go directly to the CDC, they explained, because some hospitals have not been reporting the information daily or completely. This is upsetting to hospital industry leaders, as they insist the data collection difficulties lie with the HHS and the constant changes in federal instructions. The new delivery system began on Wednesday. Healthcare institutions are required to report coronavirus data to a federal contractor or to the state, which would coordinate the reporting. Public health experts say bypassing the CDC could harm the quality of the data and the federal response. In the prior reporting system, about 3,000 hospitals or hospital systems sent detailed information about coronavirus patients and other data to the National Healthcare Safety Network, the long-standing hospital network of the CDC. The staff would analyze the data and provide reports to every state twice a week and multiple federal agencies every day, according to a federal health official. Local health officials and policymakers used the information to identify trends. But removing the CDC from the process could further marginalize the agency, some experts feel, when the pandemic is worsening throughout much of the U.S. with new records being reported for new infections. I worry greatly about cutting CDC out of these reporting efforts, said Jennifer Nuzzo, an epidemiologist with the Johns Hopkins Bloomberg School of Public Health's Center for Health Security. I see little benefit from separating reporting of hospitalizations from reporting of cases, which CDC currently coordinates. Before the Azar and Birx letter then was sent out late Monday or early Tuesday, there were earlier drafts directing state leaders to use the National Guard for data collection. It's now an option for improving the process of delivering the data, according to copies of the letter that were obtained by the Washington Post. It was Birx who first brought forward the idea of bringing in the National Guard, according to two industry officials who attended the meeting. Given our track record of being cooperative to evolving data requests, it's perplexing that the possibility of using the National Guard has been suggested, said Rick Pollock, the president of the American Hospital Association. It makes no sense. Certainly, the expertise of the National Guard can be used in a more productive way. HHS officials met with hospital representatives and state health officers to discuss the new protocol. A senior hospital industry official and others who were present reported that there was no mention of the National Guard in these meetings. The final version of the letter informed governors that the data submitted from hospitals and health officials is not always complete or timely enough to be effective. We ask that you demand this of all of your hospitals, especially those that have failed to report daily or complete. Please insist that every hospital leader assign this reporting responsibility as a mission-critical assignment, continued the instructions. If need be, you could consider prioritizing National Guard duties, in coordination with state health officers and emergency managers, to serve reporting needs for hospitals in the red zones.